My name is Josephat Moses Uchieng, the Director, Macmillan Medical Training College. Today we've had a public lecture wherein we've invited various experts in matters concerning public health issues and brain disorders. I will not take much time, but allow me to welcome the Chief Principal to give her remarks. Then we have Dr. Nelly, who was leading this conversation, will give a remark. Then Professor Ogolla will conclude this. Thank you so much.
Thank you so much, members of the press and for the general public who are able to attend. We have learned so much. We are having this conversation. Sorry. So, my name is Sarah Uganda, Chief Principal, Macmillan Medical Training College. We have had an amazing conversation regarding developmental disorders and the autism spectrum. We would like that we all join in the conversation. Let's see how we can better the life of the caregivers, people living with these disorders and these conditions. Just to continue with this conversation, we call out to the policy holders, people, the general stakeholders, people in schools. How do we make our environment better for this special population? How are we coming in as churches to make the environment better for this special population? So we'd not just like that this conversation ends here, but we'd like us to take it outside there and see on the best way to improve the life of this special population. So thank you so much all those who have attended. But above all, we want to keep having this conversation and build up a community that is sensitive and are able to keep up and be very inclusive with this special population. Thank you so much. I'd like to welcome Dr.
Thank you all. My name is Dr. Nelly. I'm an obstetrician and gynecologist in practice in Nairobi. Today has been an honor to be invited to the university as a keynote speaker in a topic that is fairly close to my heart. I always say there's no mom or there's no dad who goes out to have a child who will just survive. Every parent wants their child to thrive, irrespective of what complications they may encounter. There's a lot we can do on our end to reduce the occurrence and the severity of neurodevelopmental disorders. There are others that may be beyond us, so it's upon us to work, create public awareness through support policy change that acknowledges this community as part of us. 3, destigmatize, destigmatize, destigmatize. These are our children. They will become adults who are able to fully contribute to society, but only if we give them a chance. So I'd like to do this together. Let's come together as the future health professionals who will work in this space and take care of this for all of us, because we are potential parents, and for the community that supports all those who may be living with this condition. Thank you.
Thank you. And just before we talk, perhaps our mom can also give remarks.
Hello, my name is Lavenda Machuka, mom to a baby with hydrocephalus and spinal bifida. I just love to say having those conditions is not a death sentence. The child can live a normal life, and you as the parent or the caregiver help them to reach their full potential by loving them and providing the medical care they need.
I'm Fred Ogolla. I'm an economist and governance expert, and that's why I was so excited when I heard Dr. Nelly talk about this condition. Because see, I'm a consumer of data, and data that stuck on my head is that over 52 million children live with this condition, and that 95% are living in countries with low income. It means that this problem is a Kenyan problem, is an African problem, and therefore it is our problem. We cannot hide away from it. When we are working with Dr. Nelly, we used to discuss about human resource and health. And I'm very grateful to Macmillan Medical College for responding to this very important need of caregiver. Because you can get a doctor who can give you medicine, they can prescribe something. But the person who sits with you beside the bed, the person who, when you cough, when you sneeze, or when you vomit, or for example, when you want to be helped that sometimes family members are stressed out, that person is very important to you in accompanying you to treatment. And I want to call upon the Kenyan community to come together and see the need for dealing with children who are challenged, who have brain development challenges and disorders. Because some families hide them. That's why we don't see them. Don't be ashamed, like Mama has said here, that don't be ashamed of the child you have. Every child has been born by God. And also remember a very important thing that has been said by Dr. Nelly Bosile, that a mother is a mother from conception. As a Catholic, life begins at conception and it ends at resurrection, isn't it? So before those things take place, it's important for us to check to see whether that life beginning, pre-pregnancy condition, preconception conditions are taken care of, pregnancy conditions passed, and after that we go to heaven to our Father. So I'm sure this is what important. For the policy makers, you say a budget was read, you do not know how much budget was read to target the human resource for health. When we don't do that, we suffer. I want to end by saying health is wealth. Brain health is even a bigger wealth. God bless you. God bless Kenya. God bless Macmillan.
I have a question to the director. So my question is, since you are director for a very big school, right now we have gaps. What gaps still exist in the healthcare system that need to be addressed in order maybe for Kenyans to understand this brain disorder that is affecting kids?
The major gap that exists now is human resource. When Dr. Ran was giving a presentation, he mentioned that, if I'm not wrong, in general there is shortage of manpower and of professionals to handle this. So as an institution, specialists. As an institution, first we are responding by offering training in our basic level that we can manage as a mid-level training college. But most importantly, what we are doing right now here is to provide these are civic education and sensitization of the nation to respond to this, and therefore that is why we are calling upon policymakers to look at this matter and this issue with a keen interest and a keen eye. And number two, the government to allocate budget for training effective manpower to handle some of these issues.
But also, most importantly, a culture of execution. Policies could be there, but the execution of that culture is what we're doing. So Macmillan, what is important is not by asking what someone can do, but what can you do? So the journey has begun, and we are willing to walk that journey. What we are asking is join us in that journey, and then we can walk it together.
I want to talk about the real issue, the autism issue. We've had so many misconceptions about the kids who have been affected with the autism. So can you address that issue, like the misconceptions that exist? Maybe if you have.
I think it's important to know that autism spectrum disorder is not a disease you aim to cure. Because it's not a disease, it's a condition. This is who you are. So I think the first issue is for us to get out of the space where we look at them as if they are not value adding because they have the condition. You'd be surprised that some of the world's most renowned scientists, performers, artists, are actually having autism spectrum disorder. So we always say that